Hi friends, today I'm going to talk about oral cancer. Now just this word oral cancer, so much of a fear it creates in everyone's mind. So by looking at this video completely, lot of your doubt, anxiety will get cleared, and you can have a peace of mind as to whether really you are suffering from the problem or some of your friend, relative could be suffering, or is just a fear. So without wasting any time, let me come to discussing about oral cancer. Now, why I should be discussing about oral cancer? Let me tell you friends, 12 years I have been in the field of dentistry and I have done my specialization in oral medicine. Now, what is oral medicine? This field, 3 years of MDS I have done just in diagnosis of oral cancer. Yes, just 3 years in diagnosing whether you are having oral cancer or no, I have spent. So I know exactly how it looks, how it may feel to have oral cancer, what are the signs, what are the symptoms. So I strongly recommend that if you are afraid that any of you or your friend could be having, please do watch this video. It will really help you. Besides just studying MDS, I have also worked in various reputed institutions like Tata Institute. So this video, I have tried to compile everything which I have learned for so many years to help you all. So before we get into the problems with oral cancer, we should know what exactly is cancer. Now friends, cancer is nothing but your body cells growing abnormally. So typically what happens is, you get a cut, the body starts to heal it, some of the cells will die, some new cells will come, and the tissue will be back to normal. But as the definition of cancer says, this cancer is an abnormal, uncontrolled growth of body cells. So the body cells, your own body cells are dividing, multiplying, eating away the adjacent body parts. It's really a mess. And this exactly when it happens in the mouth is called oral cancer. Now, why does it happen? Why some people develop oral cancer and some don't? Now, 80 to 90% of the people develop oral cancer because of the reuse of tobacco products. Smoking, eating pan, gutka, supari, these are the most common causes of oral cancer. Now, why the remaining 5-10% then develop cancer? I have seen from my experience that lot of time any sharp edges, sometimes someone is wearing a denture with a sharp edge, or there is a very sharp tooth and it is constantly cutting on the cheeks and the tongue, and you are just applying some gel, not bothering otherwise, or having very poor oral hygiene, or maybe some genetics. These are some of the other common causes of oral cancer. So once someone gets oral cancer, what are the typical signs and symptoms? Now, some of the symptoms of oral cancer are actually small ulcer in the mouth, but it is just not healing. Typically, an ulcer will heal in the mouth in 2 to 3 weeks time, but if the ulcer is not healing for more than 2 months, 3 months, please get yourself checked. It could be oral cancer. Sometimes there is a growth in the mouth. It is not at all painful, but it's just growing and you're ignoring, you're applying some gel. Don't do that mistake. This could be oral cancer. Apart from it, certain condition like oral submucous fibrosis, where these cheeks become very tight, there's difficulty in swallowing, there is burning sensation in the mouth. All this could be related to oral cancer. So please, if you have any of these symptoms where you're not able to open the mouth more than 3 fingers, you just put your 3 fingers, and if you cannot open your mouth more than 3 fingers, you could be, and you are probably taking tobacco products, having burning in the mouth, you probably taking tobacco products, having burning in the mouth, you could be probably developing oral cancer. Friends, please don't ignore it. Now, how exactly are we diagnosing oral cancer? So try to get a specialist if possible in the field of oral pathology or oral medicine, or oral surgeon, or any good doctor who can just not give you some tube or something, lagao theek ho jayega. Don't do, or just not give you a tube or something that you will heal. Try to find out why the ulcer or the problem is not going, and there are 2 methods of doing it. If the doctor wants to do something non-invasive, he may opt for what is called as a brush biopsy or a FNAC. In this technique, only the little bit of cells are taken, they are brushed off or aspirated from that area and checked whether you are developing cancer. But if the doctor suspects that no, this could really be cancer, then most of the times a biopsy is performed. Now what is this biopsy? Is actually a very simple process done under local anesthesia, where a small portion of that tissue is cut off and sent for testing, so that you can really know in black and white, see whether you're developing cancer, and if yes, then you have to take the immediate action. So having said this, there are certain, once if someone gets diagnosed with oral cancer, obviously you have to treat it immediately. First you have to go for a CT scan or a PET scan to check the extent of spread of the lesion, how much it has spread, where all it has spread, and based on that your oncologist or your oncosurgeon can guide you whether you require a surgery or a chemotherapy or radiotherapy or a combination. But the purpose of this video is to educate you where exactly either you can remove the fear if it's just a problem. Some people, they have just some minor bleeding in the gums due to gingivitis and they come running, doctor, I have oral cancer. And some people, they are having big growth in the mouth, but because it is not paining, they are just ignoring it. So I thought this video will educate you all. If you like this video, please share this video, because somewhere someone in the family might be suffering and they will not even know that they are developing cancer. So please share this video, and if you want such more important videos from me, don't forget to subscribe to my YouTube channel. Thank you.